Okay, let's dive in. There's this projection that by 2050, the global population could hit, what, 9.7 billion people.
That's the number, yeah. A huge figure.
And while, we've made amazing progress with child survival rates, which is fantastic news,
Absolutely.
there's this other big shift happening. We're seeing this really significant increase in middle-aged and older adults worldwide.
Exactly. And that's not just more people getting older, it fundamentally changes the global health picture.
How so?
Well, these non-communicable diseases,
Ooh.
NCDs, things like heart disease, diabetes, they're becoming much, much more prevalent. It's kind of forcing us to rethink how we approach health across the lifespan.
Right, NCDs. That brings us to the core idea for this deep dive, healthy longevity,
Hmm.
which basically means staying physically, mentally, and socially healthy for pretty much your whole life, right?
That's the essence of it, living well for longer.
So our mission today is to really unpack this, drawing on a major new report from the World Bank to understand how we can unlock that potential.
Yeah, this 2024 report, Unlocking the Power of Healthy Longevity, it's quite comprehensive. It digs into these population changes, the NCD burden,
And solution.
and crucially, yes, evidence-backed strategies. It really stresses taking action across the whole life course, tackling the inequities that drive poor health, and finding cost-effective ways to make a difference.
Okay, good. So let's start with that first piece, the demographic shifts. What are the main trends we need to grasp?
Well, fundamentally, you've got falling fertility rates globally, and people are living longer, avoiding premature death much more effectively.
Okay.
The result, a big bulge in the population pyramid moving into middle and older age. So while the total number hits that 9.7 billion and then kind of levels off,
Right.
many individual countries are actually seeing their population growth slow down. And importantly, the growth of their workforce is slowing too.
That feels like a major shift for economies. But it's not uniform everywhere, is it? Are there
Oh,
exceptions?
definitely. Sub-Saharan Africa is a key example.
Hmm.
Population growth is still very strong there.
Right.
Take Nigeria, for instance. Its population is projected to almost double by 2050, mainly due to high fertility.
Wow, nearly double.
Contrast that with, say, China or Japan. They're actually expected to see net depopulation by 2050.
A shrinking population.
Yeah, fewer younger and middle-aged people. Then you have places like Colombia or Thailand, where the prime working age group, maybe 15 to 49, is shrinking, but the over 50 or over 60 group is growing fast.
So, okay, what does this mixed bag of trends mean for economies? It sounds like it could cause some real headaches, financially speaking.
It certainly raises big questions. The report points to a risk of slower economic growth, unless countries can boost labor force participation or productivity somehow.
Makes sense. Fewer workers, potentially slower growth.
And at the same time, an aging population means more demand for services, healthcare, pensions, long-term care. That costs money.
But is there an upside anywhere?
Potentially, yes. For some lower middle-income countries that still have a growing working-age population, there's this window of opportunity, the demographic dividend.
If they handle it right.
Exactly. If they can create enough jobs, expand health insurance, really invest in skills and education, what the report calls human capital, and build safety nets, then they could see significant economic benefits.
So it's an opportunity, but not a guarantee. What about people moving between countries? Does migration fit into this picture?
It's becoming increasingly important, the report argues. You have high-income countries aging rapidly, needing workers, especially in care sectors.
Right, like healthcare or elder care.
Precisely. And then you have lower-income countries with large youth populations, but maybe not always with the skills needed in the global market. So migration becomes, well, almost a necessity to balance things out.
Okay, that gives us a good handle on the population side. Now, let's shift to that other major challenge you mentioned, the rise of NCDs.
Right, non-communicable diseases, their impact is just huge, and it's growing.
How huge are we talking?
Well, they account for a massive and increasing share of all deaths globally, and maybe even more importantly, a huge share of avoidable deaths.
Things that didn't need to happen.
Exactly. Plus, they drive hospital stays, the need for long-term care, and they can really push families into poverty traps.
Can you give us a sense of the scale, like specific numbers?
Sure, the figures from just a few years ago, 2019, were already striking. Over 1.1 billion smokers worldwide.
1.1 billion.
A billion people with hypertension. 700 million classified as obese.
Wow.
And looking forward, the projections are worrying. The number of people with diabetes globally might actually double by 2050.
Double.
Yeah. And lower middle income countries are especially vulnerable here. Think about the strain on healthcare, lost workdays, the personal cost. It's immense.
And I imagine this doesn't affect everyone equally, right? Are some groups hit harder?
Absolutely.
Yeah.
The report really emphasizes this. Poorer populations within countries tend to be more susceptible.
Why is that?
Often higher rates of risk factors like smoking or poor diet, maybe less access to preventative care, and critically, they're least able to afford treatment or handle lost income if they get sick. It can create cycles of poverty passed down generations. And women often face a double burden. They might have higher rates of certain NCDs, live longer with disability, and they still shoulder most of the caregiving load, which hits their own jobs and well-being.
And beyond the human cost, there must be a massive economic price tag attached to all this illness.
Oh, enormous. We're talking trillions of US dollars every year globally, just for the big ones like cardiovascular disease,
Yeah.
cancer, respiratory diseases, mental health conditions.
Trillions.
One estimate projected nearly 47 trillion US dollars in lost economic output worldwide between 2011 and 2030, just from 5 major NCDs. So yeah, there's a powerful economic argument for tackling this.
Okay, so demographics shifting, NCDs rising, it paints a challenging picture. This is where healthy longevity comes back in as the goal, right? Remind us again what that means in this context.
Right. Healthy longevity is about maintaining good function, physical, mental, social, for almost your entire lifespan. It's not just adding years to life, but adding healthy, high-quality years to life.
Quality of life, not just quantity.
Precisely. And the report frames it not just as nice to have for individuals, but as a core development goal, something that drives equity and inclusion.
So what would it look like? What's the vision if we actually achieve widespread healthy longevity?
Well, the vision is people living longer, yes, but also healthier, more productive, more satisfying lives, contributing, enjoying life well past traditional retirement age if they choose.
And the benefits would ripple outwards.
Definitely. Fewer young people picking up risky habits that lead to NCDs later. Less chronic illness stopping people from working and earning. And importantly, less burden on families, especially women, for caregiving.
And how does this connect back to that idea of human capital you mentioned?
It boosts it directly. Human capital is essentially the knowledge, skills, and health people accumulate.
Sure.
Healthy longevity means people can use that capital over longer working lives. It improves productivity during those working years, and it pushes back the age where skills or health might naturally decline. That's crucial, especially where the workforce is shrinking.
Okay, that makes a lot of sense. It's a compelling vision. So the big question, how do we actually do it? What actions does the report recommend?
The key message is action across the entire life course. What happens early matters later.
Like investments compounding over time.
Kind of, yeah. For example, reducing malnutrition in childhood doesn't just help kids survive now, it improves their adult health and even their earning potential decades later.
Can you give some more examples of these life course actions?
Sure. It starts even before birth. Really addressing maternal mortality improves outcomes for mothers and babies. Then in adolescence, it's about sexual and reproductive health, preventing smoking, heavy drinking, obesity, addressing mental health issues.
Critical period.
It's very critical. Then during the working years, it's about protecting health and promoting well-being. And the report also notes that healthy older people can be a huge asset as caregivers, freeing up younger adults.
Interesting point about older caregivers. Now, you mentioned something earlier about the economics changing, something about critical income and the cost of saving lives.
Yes, that was a fascinating finding. Basically, the cost of saving a newborn's life, getting them to age 15, has actually gone down since 1990.
That's good news.
It is. But the cost of preventing a death between ages 50 and 70 has gone up.
Why the difference?
Well, the report suggests a few reasons. We're not fully using proven tools against things like tobacco. Public spending on NCD prevention and care is often insufficient. And there hasn't been enough investment in developing new, better treatments specifically for NCDs affecting older adults. It really highlights the value of intervening early.
Right, prevention pays off down the line. So, practically speaking, what can countries actually do? What are some concrete interventions?
The report points to this thing called the Human Longevity Initiative, or HLI. It lays out recommended NCD interventions. They fall into 2 main buckets.
Okay.
Population-based ones, which happen outside the clinic, like public health policies, and health sector ones, delivered through clinics, hospitals, community health workers.
Let's start with the population-based ones. What works there?
Fiscal tools get a lot of emphasis. Taxes, excise taxes on tobacco, alcohol, sugary drinks.
Plus in taxes.
Essentially, yes. They're very cost-effective. but the report notes they're underused, especially in lower middle-income countries. The WHO calls them best buys for NCDs.
Why aren't they used more then?
Well, often strong opposition from the industries involved. The report suggests big one-off tax hikes are more effective than small increases, but that can be politically tough.
Makes sense. What else beyond taxes?
Regulations on marketing and sales of alcohol and tobacco, rules to cut sodium in processed foods, banning artificial trans fats, and public information campaigns, social and behavior change communication, they call it.
Okay. And what about inside the health system? What clinical interventions are highlighted?
Several cost-effective ones, things like low-dose aspirin for people at high risk of heart attacks or strokes, screening and early treatment for certain cancers like cervical and colorectal, better management of common conditions like high blood pressure and diabetes.
Stuff we know works.
Stuff we know works. The HLI provides a list, and the idea is countries need to prioritize based on their own situation and resources. Maybe start with the basics and expand something called progressive universalism.
Progressive universalism. What's that?
It means, like, maybe you start by ensuring the poorest and most vulnerable groups get access to essential NCD care-free at the point of service.
Okay.
And then as your system gets stronger and you have more resources, you gradually expand that coverage to everyone. So you prioritize the neediest first, but aim for universal coverage eventually.
Got it. It sounds like this needs a really broad strategy, though. It's not just about healthcare interventions, is it?
Absolutely not. That's a critical point. You need policies on jobs, on social safety nets, on long-term care.
Like what?
Supporting older people who want to keep working. Maybe non-contributory pensions for informal workers who can't work anymore. And for long-term care, really bolstering community and home-based options, not just institutions.
Which will vary a lot by country, I imagine.
Hugely. Needs and capacities are different everywhere. So the report suggests trying things out, well-evaluated pilot projects to see what works best locally before rolling it out nationwide. And addressing gender bias is crucial too.
How so, specifically with NCDs?
Tackling inequalities in who gets sick, who gets care, who's protected financially, and finding ways to share the caregiving burden more fairly, expanding long-term care options so it doesn't all fall on women.
Financial protection feels key to all of this. If people get sick, they shouldn't be bankrupted by it.
It's fundamental, especially for poorer people and older adults. We need stronger health insurance, better pensions, social assistance. The report points out that in many low-income countries, people pay a huge amount out of pocket for health care, which is disastrous.
Right.
And for older workers, maybe policies like flexible retirement, adapting workplaces, maybe even reducing their Social Security payments to make it easier for employers to keep them on if they want to work.
So who pays for all this? It sounds expensive.
Well, country-led financing is essential. Governments need to step up. But the report also highlights the role of development banks, like the World Bank itself, providing support through loans, grants, technical help.
But can countries afford it? Especially lower income ones.
It does require increased spending, no doubt. But the report calculates that even the high-priority package of interventions represents a relatively small slice of projected GDP for LMICs by 2050. External aid will definitely be needed for the poorest countries, though.
And it's not just governments, right?
No, it has to be a whole of society thing. Finance ministries, planning, labor, gender, health, obviously. But also academics, NGOs, foundations, the media, civil society, the private sector. And crucially, people actually living with NCDs need a voice. It needs political champions at every level.
It really takes a village or maybe a whole country. Now, how does all this connect with other huge global issues like climate change, pandemics?
They're deeply intertwined. The report stresses this. Often, the places most vulnerable to climate change are also the places with high NCD rates.
Any examples of overlap or potential co-benefits?
Sure. Promoting locally sourced, plant-heavy diets is good for health and often better for the environment than relying on imported, processed, or meat-heavy diets.
Interesting.
Both the climate agenda and the healthy longevity agenda require thinking long-term, but also acting urgently now. And the COVID-19 pandemic was a harsh lesson, wasn't it?
How so?
It showed just how vulnerable people with underlying NCDs were. Reducing NCDs is actually part of pandemic preparedness for the future.
That makes sense. Build resilience in the population.
Exactly. We also need better data systems for emergencies, yes, but also for tracking routine diseases like NCDs. The report even floats the idea of a global adult vaccination program.
For adults, like for flu, pneumonia.
Yeah, boost routine coverage, but also build capacity that can be surged for future pandemics. And think about the tech developed during COVID. like mRNA vaccines. There's huge potential to adapt those for NCDs or other diseases down the road.
Fascinating potential there. Okay, so if we're going to do all this, we need to track progress. How do we measure healthy longevity?
Good measurement is vital. The report proposes using healthy longevity dashboards.
Dashboards, like for a car.
Sort of. Flexible, easy-to-use ways to track key data. Things related to health across the life course, human capital development, and especially NCDs and their risk factors. They've even developed sample ones for India and Sierra Leone using about 37 core indicators.
So policymakers and the public can see how things are going.
Exactly. Track progress, identify bottlenecks, keep the focus.
Okay, so as we bring this deep dive to a close, what's the single most important message you think people should take away from this World Bank report?
I think the core message is that healthy longevity is achievable. It's not just wishful thinking, but it demands that life course approach we talked about, a real focus on preventing and controlling NCDs, tackling the inequities head-on, and getting multiple sectors working together.
And the potential payoff is huge.
Immense. We can genuinely extend the number of healthy years people live and drastically cut down on premature deaths.
And there was one statistic in the report that really hammered home that potential impact, wasn't there?
Yes, a really powerful one. It estimated that if every country could improve its mortality reduction rate to match the top 20% performers,
Okay.
cumulatively, by 2050, we could extend over 500 million lives in a meaningful way. 500 million life years added, essentially. And in the year 2050 alone, save maybe 25 million lives that would otherwise be lost prematurely.
Wow. 500 million extended lives, 25 million saved in 1 year. That's staggering.
It really is. It leaves you thinking,
Mhm.
what's our collective responsibility here? How do we move from knowing this stuff to actually making it happen on a large scale sustainably? What's the role each of us listening right now can play in that?
That's definitely a thought to ponder. If this has sparked your interest, you can look up the World Bank's Healthy Longevity Initiative and find the full report for more detail. Think about how these global trends might play out where you live, in your work, or even in your own life. This conversation, this deep dive, it's really just scratching the surface of a hugely important global challenge and opportunity.